Good evening, everyone, and welcome to another episode of W.W.A.A podcast. I'm your host, Kristy Mickelsen, and for those of you not familiar with me, I am a romance book author and an advocate for causes such as cancer, autism, and lupus awareness. You can find my books on Amazon.com and other online retailers, and you can follow me on most social media platforms, including X.com at Kristy Books. Tonight, I'm joined by a wonderful guest, author and advocate, Katie Rader. Katie, how are you?
I'm doing very good. Thank you for having me.
You're quite welcome. I always goof up on last names. I did say that correctly, didn't I?
Yes, Rader.
All right. It confuses me sometimes. So I just want to double check so that our audience knows exactly who you are. Now, Katie, before we get into your interview, why don't you go ahead and introduce yourself a little to our audience?
Well, I am 45 years old. I am married to my husband, Chad, for 20, this year will be 22 years. We have two beautiful teenage girls, and they were 16 and 12 at the time of my diagnosis. And I'm a hairdresser. He's a police officer, and we live a very normal life, or we did for a while until my diagnosis. um and yeah, that's about it. Pretty regular, everyday, normal people.
You and I have a few things in common. My husband and I have been married almost 30 years. It's going on 29 years this year.
Wow.
And I have two children. One of them is my son Josh, who is 26, and my daughter Cassie, who is 23, who's going to have a birthday here shortly, and she'll be turning 24. And yeah, we have a few things in common.
You do
Right.
not even old enough.
Oh, thank you. My hair when I don't dye it actually
Oh,
tells a different story.
yeah, a lot of that tells.
Well, Katie, I know you've mentioned your diagnosis a few times. Let's go ahead and talk a little bit about that. Let's tell everybody what your diagnosis was, first of all.
Okay, so I'm just now 2 years out from my very last chemo. Back in 2022, actually November of that year, the week before I was diagnosed, my teenage daughter had only been driving. She was 16, like I said, and she'd only been driving for about 6 weeks when a semi truck hit her. And she was
Oh
able to
my
walk
God.
away. Yeah, she was able to walk away with minor injuries, and our car was totaled. And exactly 7 days later, I had my very first mammogram. And because of COVID previously, like I said, that was 2022. So with COVID and everything, my appointment had been canceled and rescheduled, and um, it was time for me to finally do it. So I was 43 barely, and so I was technically a little late because they want you to start them at 40. But in my family, colon cancer is, it's not genetic, but it's something in our family. Um, so I had never really worried about my mammograms. I was more getting my colonoscopies regularly. And one day my doctor just looked at me and he said, "You need to get your mammogram." So I said, "Okay." So I'd had it scheduled before my daughter's accident. And, the accident was, thank God she was fine, but, the legal stuff, the insurance and the attorneys and all that. And so I went to my mammogram, and not having one before, I didn't really know what to expect. And when she did the first smash, I felt the lump and it hurt. And so right away, I knew there was something there, but I was not worried because I know so many women that have had, biopsies, they've had cysts, they've had lumps. And I was 43. So I was like, it's not going to be cancer. So she asked me to wait in the hallway, in the waiting area, and she said, "I'm going to have my another tech come in, and we're going to do a more in depth mammogram," which I think was a 4D. And so I went out in the waiting area, and like my family, we are very sarcastic and we joke a lot. And so me not thinking this was anything, I call my husband at work and I'm like, "Hey, I'm at my first mammogram, and she found something. Do we have Aflac?" And he was like, yeah, we have Affleck. So I was like, okay. And he's like, do you want me to come up there? And I said, no, it's going to be nothing, you know? So he's like, okay, let me know. So by then the lady calls me back in, and the the two of them worked together, and they examined me again. And by this time they were, I mean, they're very kind. I don't know where you get your mammograms, but they are just super, super sweet. And by this time they were even sweeter. Like I could tell they were concerned by their demeanor, and they were not whispering but talking in hushed tones and acting like, making sure they were accurate. Do you see what I see? You know, all these things. And so by then I did start having emotions. I started tearing up, and I'm like, obviously there's something wrong. I still wasn't thinking cancer. I still was thinking they're concerned enough that I'm having this test, but by the time I leave here, everything's going to be fine, you know. So they asked me again to sit in the waiting room, and they said, "Are you in a hurry today?" And I remember telling them, "Well, no, if you need me to stay, you know, I just have to pick up my daughter from school later on." And they said, "If you're not in a hurry, we are going to call the radiologist to come back from his lunch break, and we want him to do an ultrasound." So I think I was just in such a, you know, it becomes very surreal, like you're watching a movie. And I think I even say that in my journal, that it became like a movie and it wasn't about me, only it was. And so I had my things in a locker. And so I didn't call my husband or anything because I thought I'll be right out and this will be over and I can call him and say everything was fine. So I go into the sonogram room, and she ultrasounds me for at least an hour. No
Oh,
word,
wow.
yeah, no words were exchanged. And by this time I'm laying down, and I'm my just tears are just streaming. And when she's finished, she said, I am going to go ask the radiologist if these are the images that he is happy with, and I'll be right back. And as soon as she left the room, almost immediately he came back in with her. And if this hadn't been my first mammogram, I probably would have been like, oh, this isn't normal, you know. But now I know that's not normal when the doctor comes in. And he looked me dead in the eyes and he said, with everything going on in your right breast, he said, I can't remember how he worded it. It was like, with everything in your right breast, I'm now concerned with your left breast as well. And I want to order a biopsy for each breast. And then he looked at me and said, do you understand what I'm saying? And I said, I think so. I said, I know you do this every day for a living. You know, this is your job. And I know you can't really tell without a biopsy yet, but how sure are you? And he said, I'm absolutely positive your right breast is cancer. And of course, then I lost it. And
Absolutely.
because I thought, how can a doctor tell you without a biopsy, but yet he knows what he's looking at without a biopsy because he does this every day. So they were, you know, everything after that was a blur. I got in the car and just called my husband, and I was hysterical. And I prayed the whole way home. I was like, God, please don't take me from my children. Um, you know, because they were teenagers, and not that any age is okay for a mom to be away from her kids, but you know, they were still school aged, and I just every kid needs their mom no matter what. So sorry.
No,
Um,
that's fine.
so I got home, and my husband met me at home, and I mean, it was everything you think, just because at that point you don't know you're going to be okay.
Right.
You know, I can look back now, and all of it was for a reason, and I know now my purpose is to be an advocate. Um, and to share my faith and my journey through the whole thing. But you know, that day I didn't know that was the purpose. And so we started making a plan from there.
Right now, I'm going to tip my hat to you before we even get into this. And I do that to people that really touch my heart. I'm going to tip my hat to you right away. But before we go any further, let's back up just a little bit. What exactly, for the people out there that don't know, what exactly is a mammogram and what happens during that visit? Like, what exactly do they do?
Okay, well, that was my first one. And before it was all over, I had six. But then I will
Wow,
never have to have one again. So that's kind of a plus.
that's a plus.
So it's this high tech, like when I went in this room, I'd heard about them, everybody had talked about them, but it really is unbelievable what they're able to see inside your body. And it's like a platform, and you set your breast on there, and they tug and they pull, and even if you think you don't have enough breast tissue to have a mammogram, they can make it work. And then
Yeah,
another platform comes on top of that and smashes, not gently, but not softly either. And
right.
and then they take pictures, and they're able to see somewhat of the lymph node area, I think, under your arm. It just depends, I guess, on how they position you. Um, and that was the 3D mammogram. And then I guess if they see something on that one, then they get out the 4D machine. And it worked the same, pretty much the same way. I think it's just more in depth.
So, what I'm understanding now, I've had a few mammograms, but for our listeners out there, the way I'm understanding it from you and from my own personal experience, it's kind of like an X-ray, but a deeper X-ray. You can actually see all the tissues inside of your breast. And for the women out there that don't know, our breasts are very full of tissue. There's different tissues from when you're pregnant and you have the milk ducts, and sometimes that could be an issue where it's clogged up. There's all kinds of things that an x-ray or a mammogram can pick up, and in this case they picked up a tumor in Katie's breast. Now, Katie, when you heard from the doctor that he was pretty sure that it was cancer, how did you feel in that moment in time? Like, I know at the time you weren't really thinking too much that it was anything, but now you're on your way home. You're ready to go to your husband. What thoughts were going through your mind?
Um, to be honest, death.
Yeah,
And and it's sad because that's what a lot of times does happen, but not every time. And I think that we have so much fear of the word cancer, and we don't realize how much hope there actually is, and how much how far we have come with treatment. And that's why early detection is so important, because they can treat so much of it. And but when you've never been through it, like I learned so much, and I know so much now because I've gone through it. But I didn't know there were different kinds of breast cancer. I didn't know that you could get breast cancer in other parts of your body. There's so many things I learned just going through it. And now that I know, I feel not silly for being so upset, but I feel like I wish I had known that in the beginning, because then maybe I wouldn't have been so distraught finding out. Um, because there just is so much out there for treatment and curing. And I know I met so many women who have been living 30 years past their breast cancer, and they're doing wonderful. And that is very hopeful to me.
absolutely. Now, I know when I went through my breast cancer scare in 2019, I had a purple lump it was actually underneath my breast, and it started to turn my entire breast purple. And
Oh,
then my breast started to indent, kind of like an old rotten orange. And those are a lot of symptoms of inflammatory breast cancer.
yes.
And when I went to the doctor, they did it like you, mammograms after mammogram. They saw a 1 millimeter mass inside of my breast, and they did an ultrasound. And there was two nurses in there, and they would talk back and forth like yours did, but they still weren't sure because it looked similar to a cancer cell,
Yeah.
but they weren't sure. So they went in and did a biopsy and a removal. And I was scared for 2 weeks
Uh,
waiting on pathology to come back. Thank goodness it was not cancer. It turned out to be a abscess cyst inside of my breast. And then, but what are some of the symptoms that a person should look for that might be something to worry about, that you should go to the doctor? What are some of the symptoms of breast cancer that you could share with our audience?
well, definitely what you had going on, that's obvious because that is one of the, I think, indenting or your nipple inverting. Of course, if you have any kind of lump. Now, around your cycle, you're going to have more tenderness, you're going to have more lumps and be more sensitive. Um, but they also say cancer isn't painful, which that's not true because about a month before my mammogram, I remember in my right breast, I had shooting sharp pains. And I'd had them before, like around my cycle time. But these would last and be like breathtaking, just piercing pain. And I remember thinking, I have a mammogram coming up in a few weeks. I'll just talk to the doctor then. And I didn't even remember that until weeks later after my diagnosis that I'd had those pains. Um, but definitely it was not normal. And I think we as women know our bodies and we know when something doesn't seem right. And I've had friends that had issues with their breasts and the doctor kept saying, it's fine, everything's fine. And they knew it wasn't fine. And one of my girlfriends fought for herself for a year and they finally found triple negative breast cancer. But she was advocating for herself. They kept saying, you're too young. We don't see anything. We're not finding anything. And she was having pain and she knew. She was like, I know there's something wrong. So I think on top of your, self examinations that we're supposed to do once a month, just be hyper vigilant about your own body and get to know yourself and what's normal and what's not. And everyone's different, all of our bodies are different. And some people have lumps and bumps and some people don't. And I just think definitely self advocacy and, not that your doctor doesn't care, but they're busy too and they see so many patients all day. And I think that it really matters if you stand up for yourself.
Absolutely. I'm going to dig a little deeper. I am known for digging in and kind of pulling out emotions out of some of my guests, and I want to dig down to your cancer journey itself. And this is actually the reason why you wrote your book. Go ahead and tell us the title of your book really fast.
You don't need headlights to shine.
Which I love that title. And it originally, ladies and gentlemen, it had an original title of Titty Tales, which I actually really loved. And that's what actually drew me into her. I found Katie on Instagram and I saw a picture of her book that said Titty Tales. And I fell in love with that. And I saw the topic and I was immediately drawn in and I contacted her. But I want to go through the cancer journey itself. And that's what her book is about. It's about her journey. It's basically her journal of her time going through cancer, the treatments, and everything that came along, the emotions. So let's go back. You just found out the news. You're on your way home. You've got all these emotions running through your mind. You get home and you tell your husband. What happened after that?
Well, I had my husband. We didn't want to tell our girls anything until it was definitive. And I'm a very impatient person. And I'm like you, waiting 2 weeks to get your biopsy results. I, that emotion to me had to make you go crazy. Like waiting and just like you're on this precipice of like, what next? So we had a plan and, I had my husband call both of our mothers and tell them I couldn't speak for at least that day. Um, and then I began the journey of trying to they had given me a biopsy 3 weeks later, a date for a biopsy. And I said, I cannot wait 3 weeks. So I contacted one of my girlfriends who worked at a different facility, and she was able to get me in 2 days later at her facility. And then, but I think that was on a Wednesday. And then by the following Monday, I had my diagnosis. So for me, it was very fast paced. I had so many people praying for me and so many things that just went my way. And that helped. By the time I got the diagnosis, about a week later, I had two very close clients of mine. Like I said, I do hair, and they both worked at Moffitt, who is the one of the top rated cancer facilities in our country. They're 30 minutes from me. And so two of my girlfriends worked there in the breast clinic. I called them and I said, I've just been diagnosed. And they said, get here now. We will fit you in. And I got in with the surgeon and we made a plan. And then I had another MRI. I had more mammograms. And then they looked at my pathology and they confirmed as well. And then we set a date for my surgery. So I was diagnosed November 27th. And then that January 3rd, I had a double mastectomy with what they call direct implants. So by the time I left the hospital, I had breasts, but just no breast tissue. I just had implants with skin over them. And I had invasive ductal carcinoma. It was stage 2. By the time they got in there, they had found 3 tumors total. The one hid 2 others behind it in the mammogram. And so it was a good thing I had chosen to have the double mastectomy, because the size and quantity of the tumors, I would have had to have a mastectomy. And then I had lymph node involvement as well. And that was so during the mastectomy, they take lymph nodes and test them. And they test them in the room and they came back clear. So when I woke up from surgery, I was told my lymph nodes were clear, but they also send those off to pathology. And 2 weeks later, those results came back and I had lymph node involvement. And I knew that that meant further treatment.
Now, you say that the lymph node involvement, double mastectomy, these are big words for some people in the audience. When it comes to a double mastectomy, that is taking the full breast, am I correct?
Yes. Mine, since it was ductal, they had to take my nipples. Um, there is surgery where they have nipple sparing surgery. I was not offered that option, and I would have declined it, but I describe it as like carving a pumpkin. You take all the inside out and just leave the skin, and then they filled my skin with an implant.
How I'm sorry, I'm just going to get deep with you here. As a woman, you lose your breast. What does that feel like? Like explain to me what the emotions were behind that.
That part of it, I was thankful to be cleansed of the cancer. And then I was so busy healing from major surgery that that never really clicked with me until later on in my story, because I ended up losing a breast due to infection. And so I had one breast and then I didn't have the other. And that point was probably my lowest point, because then I realized what some women live with. Some women live like I looked at that point, and it was very emotional. I was very mad because I was so far into my journey and had lived with my new breasts for a year,
Right.
and this was taken from me. And so I felt what's a good word? I felt, it was ugly. It was, I was, you know, I can't even think of the word, but that's chemo brain, by the way. Um,
My daddy
I,
had it.
yeah, and it's a real thing and it's crazy, but I was misshapen. I was deformed. And it really made me think about the women that don't have the opportunity for reconstruction, or they have failed reconstruction, or they choose from the beginning not to have reconstruction and they just choose to have prosthetics or nothing at all. And I just thought, I don't like this. I'm not happy with this. And not that breasts define you, but you're so used to how clothes fit. You're
Right.
so used to feeling a certain way. And I felt very vulnerable because I had no tissue there and it was basically just my ribs.
Oh, wow.
Yeah.
I know when I was going through my scare those 2 weeks, I was scared that, okay, if this ended up to be cancer and I lose my breast, that I was going to feel like less of a woman or that I was going to be unattractive to my husband. Did you
Mhm.
go through those feelings?
Absolutely. And that's honestly, that was the hardest part of cancer for me, was the after part. Nobody really talks about it. Nobody prepares you for it because I'm 2 years out and people think I'm just done. They're like, you've had your surgeries, you're back to normal, right? And I'm like, no, actually, I'm a completely different person. I And not in a bad way, but you do grieve the person that you
That
were
you
before
were.
that day, because that once November 27th happened, that old Katie was gone. And so 2 years later, I'm trying to find the new Katie and the new emotions that come with your new body. And every time you hear about someone getting cancer or their cancer has reoccurred, you think, could that be me? You know, there's a lot of things that nobody talks about after.
Speaking of things that nobody talks about, let's dig into your treatments. I know a lot of people, as you said, they look at you, oh, you've had your surgery and things must be fine, but a lot of times they don't know the hell. I'm just gonna be blunt, the
Yeah,
hell of the treatments that you've gone through. Tell us a little bit about the treatments you have endured.
right. Well, once they found the lymph node involvement, I knew that meant chemo. So my oncologist referred me to a medical oncologist, and she's the one that orders the chemo. And she said to me, my surgeon said to me, now I don't know that she will order chemo, but I knew, that they would. And they had never taken radiation off the table either. So I went to my medical oncologist appointment and she told me, I mean, flat out, this is the regimen that I would have for you. And I don't think I got emotional that day because I had prepared myself by the time I saw her. Um, and we talked about, you're going to lose your hair, you're going to be probably sick, you're going to be tired, all of these things. And I'm self employed. So I thought, how am I going to work? How is this going to affect my family if I can't work for however long? Because I didn't know. And she said we would probably do 4 rounds of chemo, one every 3 weeks. And then she referred me to the radiologist. And then he ordered 25, 25 or 30, I can't quite remember, radiation treatments. And then when people hear that, and you finish that and you celebrate, you ring the bell and it's great. But I have to be on hormone blockers, which is basically an oral chemo, a pill form, for 10 years. And then I
Oh
take
my
another,
God.
yeah, I take another. So I take 2 oral chemos right now. One is for 2 years and one is for 10 years. And those take a toll on your body as well. And people just, I didn't know about that either. And my mother in law had gone through the exact same breast cancer. She had gone through chemo, she had gone through radiation, and she took the hormone blockers. And so here I am 2 years out thinking, wow, my mother in law went through so much unbeknownst to all of us. And, it's just part of the journey that no one seems to discuss.
Absolutely. I I'm sorry if this brings up any negative thoughts or anything, but what exactly goes on when you get chemo? I remember stories from my dad, as I've told you before in our pre discussions, that my father was a kidney cancer patient. And I can remember him going to chemo and he'd be freezing.
Mm.
And I never understood
Uh,
until I read your book. And
yeah.
I bawled. I started crying because
Oh,
I felt so bad for you and my dad. So
yeah.
let's go ahead and tell our listeners what it's like in those chemo infusion rooms.
So the infusion room, it's like a little cubby. It's very private, at least at Moffitt it is. They're so kind and they make it as cozy and comfortable as possible. Um, in my very first chemo, they hooked me up and I was supposed to drip for, I think the first bag was, I had docetaxel and I ended up being I had anaphylactic shock from my first, and I
Oh my
stopped.
God.
I mean, it was so scary, and then I wanted to stop after that. So I went into anaphylactic shock about 30 seconds after the drip started, and so
Oh
as soon as
wow.
it hit my bloodstream, I was purple and not breathing, and I remember I hit the call button, and they came instantly. And then I think they gave me, epinephrine or whatever, and my throat opened and I was hysterical. I, I couldn't even form the words to say I don't want to do it because I was so hysterical. And then with the Benadryl and everything they were pumping into me, I just got really sleepy. And I also did ice therapy, which is where they strap ice bags to your hands and feet. And that prevents the blood flow from reaching your fingertips and your toes to help with neuropathy. They also have what's called a cold cap, and you can strap this cold, like ice helmet on your hair, and it can help with preventing hair loss, which I opted out of that because I just, I know my limits as a person, and I thought, I don't want to be cold for 6 hours. Um, so after I had the reaction, they let me sit for about 30 minutes to make sure I was okay. And then they began the drip again at half the rate. So then I was there even longer while they were pushing it through. And then all the rest of my chemos were smooth because they gave me the prevention drugs to help me not have the reaction, and I didn't. Um, but it was still scary, and it was every time I would get chemo, I would feel terrible for a couple weeks, and then I would start feeling good again, and it would be time for another chemo. So it's very emotional, the up and down, and knowing that that's hanging over your head, and you have to go, and knowing how you're going to feel afterwards. Um, I finished the chemo that April, and then I began radiation. And for some people, that's a lot worse. I was tired because it's every single day except Saturday and Sunday. And
Oh
it
wow.
doesn't, you're not there very long. You're there maybe an hour, but I think it's just zapping your body of its energy. And then towards the end, your skin is burned, like
Oh
a
my God.
blister. Yeah, like a very bad sunburn.
Now let me ask you this. again, when my dad was going through chemo, he ended up, I guess it was called toxic. He was toxic to interferon.
Yes.
His his legs started turning purple. He had all these purple bumps. He had bumps inside of his throat. He couldn't eat. He couldn't talk. Uh, a whole bunch happened with him. Did you encounter any of like the blisters on the tongue, any kind of bumps on your skin, eyebrow loss, muscle loss? What did you go through with that part?
Total body hair loss. Um, I was cold all the time. I still am because I take the oral key. And before I was a hot natured person. I freeze all the time. Even in Florida, yes, I freeze to death. Um, I did at one point have boils on my right leg. I had over 60 boils, and I
Oh,
went to
wow.
the emergency room, and it was just my right leg, nowhere else. And they were perplexed. They could not understand where these boils came from. And I remember being in the urgent care at a cancer facility, and all the doctors and nurses are like, "We just don't know. We think, could it be bed bugs? Could it be, oh yeah, they thought it were bed bugs." And then they asked me if I like to go hiking. And I thought, no, I'm not hiking while I'm on radiation and chemo. And
Right.
I'm not hiking on a regular day either, but I wasn't hiking. They thought I had bugs or poison ivy or whatever it was. And finally, my mom did a little research, and she found a study where boils are a very rare side effect of chemo. There are
Oh,
skin irritations, which I did have. I still get mouth sores and nose sores, because all of these drugs lower your immune system,
yeah.
and your body's just trying to fight in any way it can. And so it goes, it's just, it's wild, the things that happen.
Now we're going to be winding down soon, but I want to jump ahead just a little bit. Your book talks a lot about your journey. You had quite a sense of humor through a lot of it, and I loved that about you. You had me from tears to laughing in a lot of spots, so I applaud you for that because that was wonderful. Um, what did you're going through chemo? You have all these things going on with you because of all the side effects, the blisters, the hair loss. What would you say was the impact to your family? Was your husband upset? How did your kids react? Tell us a little bit about that.
That's a good question. Once we finally did tell the girls, they were upset because, like I said, my mother-in-law had battled before. So, of course, I'm sure they thought the worst at the beginning. Um, but everyone always commended me for being strong until they read my book. I think most people in my life didn't realize what I went through, and what you go through as a cancer patient or any chronic illness, honestly. Um, they felt like they didn't know because I always acted like everything was fine. And so my husband would say, I wouldn't feel good at times. And I would say, the kids don't understand, or, so and so doesn't understand. And he'd say, because you act fine, you act like you're doing so well. And it wasn't an act, but I didn't go around complaining because there wasn't anything anyone could do about it, and I'm the kind of person that if you're going to complain about something, do something about it. And I knew there was nothing I could do. I just had to get through it. And so I saved the complaining for my journal. And so that when a lot of, even my neighbors, when they read it, they said, "We had no idea. We live next to you and see you almost every day, and we had no idea the things you went through." Um, but that was just how I handled it because I didn't always want to talk about it. I talk about it now because I'm doing well and I want to help others. But during it, it's like the more you talk about it, the more real it is. And you kind of just want to escape that reality, I guess.
Yeah, absolutely. Well, what about your daughters? Let's talk about that for a second. Here's mom. She's sick. What? did that affect their lives? I mean, of course it affected their lives. Of
Yeah.
course it did. But how did it affect them? Was it more of a I lost friends over it, or were they very protective over you? How did they change through all of this?
I'm sure they have their own stories, because those are developmental years, that they were going through that. And I was kind of an absent mother. Um, I remember school starting and that year, and I had always been over the top prepared, their uniforms, their supplies, and I was completely disconnected. I didn't know really when school was starting. I didn't know what they needed. And I my husband was wonderful because of course he took care of all of that stuff. So emotionally I disconnected myself, and I'm sure there was impact for that. But they and their friends rallied around me and loved on me, and Miss Katie's awesome, and we love your mom and she's great, and they would bring me gifts and flowers, and um I I still think it's too early to see the real impact it had on the girls, to be honest. They I think I kept a lot from. Now my oldest had she read my journal in real time while I was writing it, because it was I had it linked to my Apple account, and so she would log in and read my daily stuff, so she knew the whole time. But my youngest still hasn't read it, and
Oh,
I don't think she wants to. I mean, she definitely doesn't want to. I'm not quite sure why, or if she just doesn't want to relive all of that, what our family went through. My husband held down the fort really well, and he was affected too because we've talked a lot about it since. But it's rough. It's a rough thing to go through. With you're not in it by yourself. I mean, your whole family is affected for sure.
absolutely. That's something that I don't think a lot of people in today's world actually understand. It's definitely the cancer patient, but also everyone in your family is affected because we're all caregivers, and it's hard for the caregiver to watch the whole
Yeah.
journey of it all because you're seeing a lot of different changes. You have this happy, healthy person, and then all of a sudden they're going through chemo change. It's a big change, ladies and gentlemen. Katie, I have to say, again, I tip my hat to you. You're a wonderful, wonderful person. I have tried several times not to cry already. We're going to go ahead and wind it down just a little bit before we start to actually wrap up. Tell us where people can actually find your book
Okay,
so they
that's a
can learn more about your journey.
so I named it Titty Tales because while I was writing it, I shared it with my girlfriends and my close friends, and they would say, "How are you doing?" And I'd say, well, "I'll send you the titty tale of the day, and you can read how my day was." Because this was never going to be a book. This was my journal. There was no plan for a book at all. And so when that all happened, and I guess you can read in my book to find out how that miracle happened. Um, my publisher said, "What have you thought of a title?" And I said, "Well, I've been calling it Titty Tales." Um, then once the book came out this past October for Breast Cancer Month, it was released October 2024. Um, I had a couple opportunities to be on local TV. Well, titty is one of the, I think, 7 or 8 words that you cannot say on public TV. So they would interview me on TV and say that I wrote a book about my cancer journey, but they could not show the cover or talk about the title. So just a few months ago in January, well, it happened in January, but we talked about it this past November. My publisher and I decided that it would be better to have no roadblocks as far as sharing my story. So we decided to change the title. And so it's still under until March 31st. You can still buy it on Amazon or anywhere books are sold, and it will be called Titty Tales until March 31st. After that, it will be You Don't Need Headlights to Shine, and it will be available the same way anywhere books are sold online.
That's wonderful. While we're wrapping up here, If you could tell our listeners one very important message, what would it be?
Well, for me, mine was to lean on my faith. My journal did not start out to be about my faith journey, but it quickly became what I clung to throughout the entire process. So I would say find your faith, get grounded in that, and you need something to cling to during times like this, not just cancer, but there are things that happen in life, like the week before when my daughter was hit by the semi truck, that could have ended so differently. And I had my faith to get me through that. And so, any challenge that I face, that's where I turn. And so, I think it's important for me to share that about my journey. And however you believe, you need to cling to what's right and true to yourself.
Absolutely. And that's a wonderful message to leave the listeners with. What would you say? How would you say you're living your life now? Do you feel like you're back to normal? Like, tell us how you're going now. Like, what's going on in your life now?
I feel pretty normal. I am definitely a different person. I have learned so many things on my journey, and I developed this passion to help others. Like I said, my book was not supposed to be a book. And once it became a book, I realized sharing my story and helping other women is what I really, and men, because men can get breast cancer too. um, Helping others is really what I want to do. And I became involved with the local breast cancer organization, and it's called Breast Cancer of Central Florida. And we help women in our community. We raise funds and we pay their bills while they're on treatment. And we pay for their kids' soccer camp, or we buy their Christmas gifts that year, whatever it is. And there are, big foundations that raise lots of money and lots of awareness and lots of money for research. But my passion is actually helping the people in my community. And so that's what I do since then. And I'm back to work. I am involved with my kids again. I lived my pretty normal life, even though I physically am different. It's not all in a bad way. And I met several breast cancer survivors that have been, 20, 30-year survivors, and they told me the same thing. You're a different person, but it's not necessarily a bad thing. So I feel like I have a great life, and I wouldn't give anything back. From all that I've learned and everything that I went through, it was worth it.
Absolutely. Absolutely. I want to tell you right now that Katie, you are a true inspiration. And I mean that from the bottom of my heart.
Thank you.
There is so many women out there that don't even know about breast cancer. There are women out there that don't know how to do a self exam. And I'd actually like to bring you back to the program so we can get a little more into that if you would like to come back, and we'll
Oh,
discuss that after the show. But it's you're an inspiration. I want you to know that.
thank
Us as women, we thank you. You're doing a wonderful job out here, and telling your story is helpful. And I know it's gotten a little tearful between the two of us here a couple times. And I thank you for being so open and courageous coming on and telling your story.
I appreciate you having me. Thank you.
Thank you. Before we end it, where can people find you online so that they can learn more about your book and about you?
Well, I have a website that I am under, it's under construction because I'm changing the title, obviously. But my Instagram, um, right now it's under author, no headlights. And then my Facebook page is You Don't Need Headlights to Shine. And if you have any questions there, you can message me through there, and I'm pretty good at responding quickly.
Thank you so much for sharing that. Ladies and gentlemen, we have been talking to Katie Rader. She has a book out right now, currently is titled Titty Tales, and you can find that on any online bookstore. And the title of the book will be changed after March 31st to No Headlights to Shine. You don't need headlights to shine. I recommend you picking up this book, women, because, and men, this book, like I said, it had me laughing, it had me crying, and it's, if you're a compassionate person, you will actually relate to a lot of things in this book. And Katie, we love you already. Like I said, it takes a lot of courage to come on and share your story. So I applaud you for that. And I want you to know you're helping, you've helped me in a lot of ways. You
Oh,
really have, because I thought when I was going through my breast cancer scare that I was being silly, that I was being silly. Oh, you're too young for this. I was 40. I think I
oh,
was 40
yeah.
when that happened. And I thought I was being silly, and I was going online constantly, and I was looking up all the signs of breast cancer. And it, I know now that it's normal. It's normal to go through those reactions when you don't know what's wrong with your breast or what's wrong with your body or anything like that. So thank you for making me feel like what I was going through was actually normal.
Yes.
Ladies and gentlemen, we are going to close down the program, but before we do, I'm going to close it out the way I would on some of my shows, and that is every day people are battling things that we know nothing about. Sometimes it's depression, sometimes it's illness, and sometimes it's something like cancer. Every day people are battling things that we know nothing about. So it's up to us. It's up to all of us just to be kind to one another. Stand up and say, hey, you're looking good today. Or, you know what? I like your hair. You look really wonderful. Or maybe you see someone struggling to do something for yourself, for themselves. So you stand up and you help them. Every day, people are battling things that we know nothing about. So stand up, be the voice, be the change, and be the one to make a difference, because you might be the one to save a life. And today, that instance is with Katie. Katie is helping some of us uh, save a life just by sharing her experience, so that we're not afraid of what we might go through if we ever experience the same things. Katie, we love you and we thank you. And with that, I'm going to say good night, everyone.